All right, get ready to dive deep. Today, we're tackling biomechanics, and we've got a fantastic guide, the Ortho Made Simple Notes from mokyingren.sg.
Excellent resource.
Yeah, they're packed with insights, and they're put together by Dr. Mok Ying Ren. He's a sports surgeon at National University Hospital in Singapore. You know, the guy who aces FRCS back in 2022.
Oh, impressive. So we're in good hands.
Definitely. These notes are pure gold, especially for all you orthopedic residents out there prepping for those tough exams.
You bet. Those exams, they love to throw in those biomechanics brain twisters, don't they?
Oh, absolutely. But you know what? It's not just about acing the exams. It's about becoming a better surgeon, really understanding how the body moves.
Couldn't agree more.
It's like having X-ray vision,
Yeah.
seeing right through to the mechanics of it all. So let's start with the fundamentals. Newton's 3 laws of motion.
The classics.
Right. Inertia, action-reaction, force equals mass times acceleration. We all learned this stuff back in the day.
Yeah.
But how does it actually apply in orthopedics?
Well, it's amazing how those seemingly simple laws underpin so much of what we do. You think about something like whiplash, that's inertia in action.
Oh, wow. I never thought of it that way.
Right. Or how we analyze the forces acting on a joint during movement. That's all about action and reaction.
Makes sense. Okay, let's talk about levers.
All right.
These notes break down the 3 classes of levers, and it's like our bodies are a walking, talking physics textbook.
Yeah, that's a great way to put it.
We've got the hip acting like a first-class lever,
Yeah.
like a seesaw.
Hmm.
Then there's the ankle, working more like a wheelbarrow, a second-class lever.
Right.
And lastly, the elbow. I kind of think of it as the rebel of the group, acting as a third-class lever.
It's true. The elbow is unique in that sense.
And that third-class status makes the elbow less efficient, right?
Precisely.
It means it needs more force to move the same weight compared to the hip or the ankle.
Exactly.
Now, as a surgeon, that's a pretty important thing to remember, isn't it?
Oh, absolutely. It helps explain why certain injuries are more common in the elbow and why we might approach surgical repairs a bit differently, too.
So it's not just textbook stuff. It directly affects how we treat patients.
That's the beauty of biomechanics. It bridges the gap between theory and practice.
Totally. Okay, so how do we visualize all those forces acting on, say, a shoulder joint?
Well, that's where free body diagrams come in handy, or SPDs for short.
FBBs, okay.
Think of it like a snapshot of all the forces at play, kind of frozen in time.
I like that, a snapshot.
We do make a few assumptions to simplify things, like assuming that bones are rigid and joints are frictionless.
So like a simplified model, helping us focus on the main players without getting lost in the tiny details.
Exactly. The notes have some really great FBD examples. Like, they show how something like a reverse shoulder arthroplasty can actually change those forces acting on the joint.
Whoa, so we can actually see how different surgical techniques impact the biomechanics.
Precisely. And it's not just limited to shoulders either. We can use FBDs to understand how weight impacts the elbow joint, the proper way to lift to protect our spines, and even how things like walking aids change the forces on the hips. It's pretty versatile.
That's amazing. These diagrams can really make sense of such complex systems, can't they?
They're a powerful tool for sure.
Okay, so let's move on to stability. Now, the notes mention static and dynamic stabilizers, especially in the shoulder.
Right.
What's the difference between the two?
So think of static stabilizers as the passive support system. It's things like the labrum, the ligaments, and even the shape of the bones themselves.
Okay.
They provide that inherent stability to the joint. Now, dynamic stabilizers, those are the active players, the muscles that control movement and keep everything in check.
So in the shoulder, we're talking about the rotator cuff muscles and the scapular rotators as the dynamic guys, the ones working hard to keep everything in place.
Exactly. It's a real team effort in there.
Yeah.
And those ligaments, especially the glenohumeral ligaments, they play a key role too, They restrict movement in certain directions.
Oh, interesting.
Yeah, knowing which ligament is most active when, well, that's a detail you might just see on those exams.
Okay, good to know. Now let's talk about the elbow.
The elbow.
What are those key stabilizers that keep this fortress strong?
Well, similar to the shoulder, the elbow has both static and dynamic stabilizers. The ligaments, joint capsule, and how the bones are aligned, those provide that static support. But the muscles crossing the elbow joint, those are the real powerhouses. They control the movement and prevent those nasty dislocations.
Right. The notes actually go into detail about which structures stabilize the elbow against different stresses, valgus, varus, posterolateral rotation. It's a lot to keep track of.
It is, but think of it this way. The elbow is constantly dealing with forces coming from different directions, whether we're lifting weights, throwing a ball, or even just carrying those groceries. Understanding those forces and how all the different structures work together, well, that's key to diagnosing and treating elbow injuries properly.
Yeah, that makes sense. And speaking of throwing, have you ever thought about how much stress that puts on the elbow, especially for athletes?
Oh, absolutely. It's a complex movement with high forces involved.
I remember seeing these crazy slow-motion videos of pitchers' elbows, and it's like, wow.
Yeah, it's pretty impressive.
The notes highlight this thing called the late cocking phase, during a throw.
Right.
They say it's a particularly vulnerable moment for the medial ulnar collateral ligament, the MUCL, and that it can even lead to something called glenohumeral internal rotation deficit, or GIRD for short.
Ah, yes, GIRD. It's a common issue in throwing athletes.
What exactly is going on there?
Well, it's all about that intense valgus stress on the elbow during that late cocking phase. Imagine bending a twig too much force in the wrong direction and snap. That's essentially what happens with an MUCL tear. And the deceleration phase, that's no walk in the park either. It puts a lot of stress on the shoulder, especially the biceps tendon and the labrum.
Wow, so understanding the biomechanics of throwing is absolutely crucial, especially if we're treating athletes.
Couldn't agree more.
We need to know which structures are taking the brunt of the force at each stage of the movement.
Exactly. It informs our entire approach to diagnosis and treatment.
Okay, now to really get into the complexity of elbow stability,
Yeah.
the notes introduce this concept called the elbow fortress,
Ah, yes, the elbow fortress, a great analogy.
developed by a surgeon named O'Driscoll.
A brilliant mind in the field of elbow surgery.
Okay, I'm loving this name already. What exactly makes up this elbow fortress?
Think of it as a multi-layered defense system. The primary stabilizers are the lateral ulnar collateral ligament, or LUCL, the anterior band of the medial collateral ligament, that's the anterior MCL, and the ulnohumeral joint itself.
So they form that first line of defense against instability.
Precisely. But then you've got the secondary stabilizers as well.
Oh, right.
Things like those flexor and extensor muscles we talked about, and the radiohumeral joint, they're providing that additional support, the backup, if you will.
Wow, so it really is like a well-coordinated army protecting the elbow from all sides.
That's a great way to picture it.
But how do we actually measure and analyze all these forces? It seems pretty complex.
That's where force analysis comes in. The notes actually provide some equations to help us calculate things like joint reaction forces in both the shoulder and the elbow.
Okay, this is where my brain starts to hurt a little, but I trust you to guide us through it.
No worries. The notes do a great job breaking it down. They show how the equations apply to real-world situations. For example, they explain how to calculate the joint reaction force in the shoulder when the arm is held straight out to the side,
Okay.
and how a procedure like a reverse total shoulder arthroplasty, it can actually reduce that force.
Really?
Yeah, by changing the position of the joint's center of rotation.
Wait, so we can actually tweak the biomechanics during surgery to potentially improve long-term outcomes for the patient.
That's the idea. And the notes even draw a parallel to the elbow, showing how carrying weight impacts those forces too.
So it's like comparing apples to oranges. The deltoid working in the shoulder, the biceps doing the heavy lifting in the elbow, but the underlying biomechanical principles are the same.
Exactly. It's all connected.
That's incredible. It's amazing how these concepts can be applied across different joints.
Biomechanics is all about understanding those fundamental principles and seeing how they play out throughout the body.
Absolutely. Before we move on, just a reminder to everyone that we're using the Ortho Made Simple notes from mokyingren.sg for this deep dive. They're an amazing resource, especially for those of you prepping for the FRCS or similar exams. We'll be back in a moment to continue our exploration. Stay tuned.
Looking forward to it. Welcome back.
We're diving deep into biomechanics using the Ortho Made Simple notes from mokyingren.sg.
Great stuff.
Really helpful stuff.
Yeah.
Before the break, we were talking about how carrying weight, affects those forces on the elbow. I'm curious, how does that analysis differ from the shoulder, considering they both involve, carrying things?
Oh, that's a great question. It's actually pretty similar. Remember how we were talking about calculating those joint reaction forces in the shoulder when the arm's held out to the side?
Uh-huh.
Well, we can use the same principles for the elbow, but instead of focusing on the deltoid muscle, we look at the biceps muscle,
Oh, okay.
which is the main player when it comes to flexing that elbow and holding weight.
Right, because when you're carrying, say, a bag of groceries,
Yeah,
your bicep is working hard to keep your elbow from straightening out.
exactly.
So we're basically swapping out one muscle for another in the equation.
That's it. And by resolving all the forces acting on the elbow in the vertical direction, we can actually see how much that joint reaction force increases because of that added weight.
So it's like having this secret formula to understand how the body handles load.
In a way, yeah.
Okay, we've covered shoulders and elbows, but what about the spine? It's got to be a biomechanical nightmare with all those vertebrae and discs, right?
You're telling me. The notes really emphasize proper lifting techniques to protect the spine. There's this really helpful diagram showing how bending over with straight legs puts massive stress on your lower back.
Ouch. I can feel that just thinking about it.
It's like imagine trying to lift a heavy refrigerator with just your fingertip.
No, thank you. So the key is to lift with a straight back and bent knees to distribute the load better.
Exactly. It's all about minimizing the moment arm of that weight,
Okay.
reducing the force on those lumbar vertebrae.
So it's like using a lever to your advantage. The shorter the lever arm, the less force you need to lift the same weight.
Exactly.
Speaking of levers, let's talk about walking aids. The notes mention how canes and crutches can actually change the forces acting on the hip. How does that work?
Imagine you've sprained your ankle and you're using crutches to get around, right?
Yeah.
Those crutches are taking on some of that weight-bearing load that would normally go through your injured leg.
Okay.
This actually reduces the joint reaction force at the hip, which can be huge for patients with hip pain or after surgery.
It's like taking a load off, literally.
Exactly. The notes also mention Trendelenburg gait,
Oh, yeah.
that characteristic hip drop you see when someone has weak hip abductors.
I've definitely seen that in the clinic.
Yeah, it's almost like their body's trying to compensate for that weakness.
So understanding the biomechanics helps us pinpoint the problem.
Absolutely. It gives us a framework to understand why people move the way they do and how we can address those underlying issues.
That's so cool. Okay, let's switch gears to the knee. The notes discuss the impact of removing the patella, a procedure called patelectomy.
Right.
What are the biomechanical consequences of taking out that little bone?
Well, the patella's more than just a little bone.
Oh, yeah.
It acts like a fulcrum, increasing the leverage of the quadriceps muscle.
Oh,
So without it, that quadriceps tendon has to work much harder to extend the knee,
I see.
putting more stress on the surrounding structures.
So it's like trying to open a door by pushing right next to the hinge point.
Exactly. You need way more force.
You need a lot more force, yeah. So the patella is really crucial in making knee extension more efficient.
Absolutely. It plays a key role in that.
It's fascinating how such a seemingly small structure can have such a big impact on how the entire joint works.
And speaking of seemingly small structures having a big impact, let's talk about flat feet, or pes planus.
Ah, yes, pes planus. That lack of arch support can really mess with the biomechanics of the foot and ankle.
It certainly can.
I've seen that a lot in my practice.
Yeah.
Does that mean the bones are out of alignment?
Yeah, that's right. The lack of a proper arch causes the foot to collapse inwards, putting extra stress on the subtalar joint and the big toe joint.
Okay.
This can lead to pain, instability, and even arthritis down the line.
So it's not just an aesthetic issue.
No, not at all.
It's a biomechanical problem that can have real consequences.
Precisely. Understanding those biomechanical changes is crucial for effective treatment, whether that's prescribing orthotics, recommending physical therapy, or considering surgery in those more severe cases.
Right. So it's really not just about equations and diagrams, is it?
Yeah.
It's about real people experiencing real problems.
Exactly. And these ortho-made simple notes from mokyingren.sg, they really highlight that connection between theory and practice.
Yeah, they're a game changer, especially for those prepping for those challenging exams like the FRCS.
Absolutely. And they're not just for exam prep. Understanding these concepts will make you a better clinician, period.
Well said. We'll be back in a jiffy to wrap things up and leave you with some final thoughts.
Sounds good.
Welcome back to the Deep Dive. We're wrapping up our exploration of biomechanics using those ortho-made simple notes from mokyingren.sg.
Yeah, it's been a whirlwind tour, hasn't it? From those fundamental laws of physics to analyzing forces on specific joints.
And even those complex movements like throwing.
Right.
It's amazing how we're not just memorizing facts, but actually seeing how those biomechanical principles translate to real-life clinical practice.
That's the key takeaway, isn't it? It's all about application.
Totally. So for all you orthopedic residents out there, getting ready for those big exams, what are the key takeaways from these notes?
Well, firstly, these ortho-made simple notes, they're like a cheat sheet for those high-yield biomechanics concepts.
Right,
They condense those complex topics into digestible chunks,
right.
making it easier to remember those crucial
It's like
points.
having a roadmap to navigate that vast world of biomechanics. They
Exactly.
highlight those important intersections and landmarks.
But it's not just about passing exams.
Right.
Understanding biomechanics, it's really fundamental to becoming a good orthopedic surgeon.
Absolutely.
It shapes how we approach diagnosis, treatment planning, surgical techniques, even rehab.
It's like having a superpower, being able to see those forces at play inside the body and using that knowledge to restore function.
And to improve patient outcomes.
And you know what? These notes, they're just the starting point.
Oh, yeah.
Biomechanics is a field that's constantly evolving. There's always new research and new technologies emerging.
Absolutely. It's a really exciting field to be a part of.
So true. And that brings us to our final thought for our listeners.
Okay.
We've talked about how biomechanics influences things like surgical planning and rehabilitation, but how can understanding these principles impact, say, your approach to patient education and counseling?
That's a fantastic point. By explaining these concepts in a way that patients can grasp, you can really empower them to take a more active role in their own care,
Yeah.
help them make informed decisions about their treatment.
And that wraps up our deep dive into biomechanics, all thanks to those ortho-made simple notes from mokyingren.sg.
Great resource.
It's been a fantastic journey exploring how these principles really shape our understanding of the musculoskeletal system.
I couldn't agree more. It's been a pleasure.
Remember, biomechanics isn't just a theoretical subject, it's the bedrock of orthopedic practice. Mastering these concepts will give you the knowledge and the skills to really make a difference in the lives of your patients.
Absolutely. Keep learning, keep exploring, and keep pushing the boundaries of orthopedic excellence.
Until next time.